to see it's really fun to see new people and new names. That is great. As has been pointed out, and Nicole so well said, is that this is a safe place. And this is where we can come together and be nurses and be vulnerable and support one another. And so I'm Cami Peterson DeVries. I'm the president of the board of the Minnesota Organization of Registered Nurses. And at this time, I'm calling this membership meeting to order. So the first off that we have is just kind of an overall, you were sent out the packet or the actual annual report and also the December annual meeting. So we're hoping to be about 10-15 minutes of this meeting, and then we'll go into Kathi and talking about our membership meeting of just having our education time. So for me, it's been an honor, and it's an honor to serve this. And I'm going to call out some of our board, but the mission and goal of this is really for us to represent this profession as an organization, and we don't exist without you. And so it's really important that that recognition happens. And we have an amazing, Kathi is our executive director. She is a one-person show, and we are grateful to her for that. I'm going to kind of go through a few things of just how I looked at when we talked about this, kind of what are our strengths, what are our weaknesses, what do we see as opportunities, and what do we see as threats. So, so again, it's an honor to represent this, and I really want to recognize and thank our board of directors that we've had the opportunity to work together over the last year. I think we've all learned a lot, and it always the year goes by fast. So, first vice president, and if you're here, just kind of raise your hand or something, just in recognition. The first vice president is Christy Walls. Patrick, and second vice president is Patrick Soria. Secretary is Linda Zaret. Treasurer has been Nikki Gree.
Jerry.
Jerry, I'm so sorry.
That's
I
okay.
looked at this and thought, oh, I should have looked at this closer earlier in these last names. Directors have included Nicole Abel, Sarah Stevens, Melissa Gleaves. And Sarah I,
Stevens and Simon.
Simons. I had Sarah Stevens twice, and I knew that I was missing one. So please join me in just thanking them for the work and commitment to this profession. Both Nikki and Nicole will be coming off the board in January, and we are so grateful for their service and all that they've done. We're going to miss them. We've also been just so grateful for Heidi Orsted. She'd been the past president. She was president for 4 years, and we have leaned on her a lot for her knowledge and support, and just overall just kind-hearted person that she is. So she is also going off the board, but we just really want to thank her also for her service. We did in the report that was sent out to you is the actual election report. So we'll now announce the results of that. The following people have been elected. So first vice president, and if you're here, raise your hand again. First vice president is Christy Walls. Treasurer is Sarah Stevens. Our directors are Kelly Ashley and Julia Ogorji. Our nominating committee is going to be Seth Swinger, Katie Clark, Annette Hines, and then our representatives to membership assembly is Nikki, and then Nick Churchill. And then our alternates are Christy Walls and Mary Ellenberger, and Seth Schwiger. Thank you, everyone. It's fun to see elections. It's fun to have those things happen. And as we know, the paths behind us are as important as the paths we're on and the paths that are in front of us. We just thank everyone for that service. So you'll see actually the teller's report on that we had the results of the polling questions that we had and what we're looking at for the A&A dialogue, looking at things that, and I can actually share my screen, actually, that might help. So we have had the polling questions. Our next step on this is to have another kind of survey monkey or something to go out to discuss to get some more input and to determine where we're going to go next year for the dialogue forums. We do know that, and Kathi will probably talk about this in her presentation, about our focus is going to be. So we'd just like to thank you all for the participation that happened with the polling questions and how at least we had good information and information that we'll be able to really build on. So our organization, and so I'll just go into kind of the president's report, and I was telling Kathi that as I was driving 8 hours in the car yesterday, I was recording on my phone my thoughts on all of this because as we look back at the last year and so this organization exists to ensure that the voice of the registered nurses in Minnesota is informed, united, and heard. We advance the profession of nursing and we support nurses in all practice settings and career stages. And we really try to protect the ability of the nurses so that they can provide ethical, evidence-based, and compassion care to every patient and person that they interact. When I look at our strengths is that we're very deeply connected across Minnesota and nationally in the through the American Nurses Association and through the Minnesota Organization of Nurses. It really does allow us to respond quickly to emerging challenges, elevate our Minnesota nurses nationally, and bring national guidance back to our state with relevance and clarity. Our membership reflects nurses' desire for professional home rooted in integrity, service, and patient-centered care. And I really wanted to emphasize that it's whenever you go anywhere, and anybody that's been able to go to assembly or have any of the meetings that are outside of our meetings, you really have this back seat view of the importance of our leadership in Minnesota organization of
I'm
registered,
coming.
which is,
I'm coming. I'm
oh,
coming. What's wrong? What's wrong? What's wrong? Oh, no.
oh, thank you. Hope it's okay. So taking a back seat and just watching that a lot of this organization's growth and the ability to respond and react and all of that is really related to the leadership in our executive director. And I really wanted to put that in our report because like I said, when you're in these meetings, you really get that part of it on how important and how connected Kathi is, and how that really impacts our ability to have a say in nursing, in advancing our nursing agenda, being able to support other organizations. She is leaned on across our nation for information, support, and ideas. And so we are very fortunate to have that in our organization and leading our organization. So I did want to really put that in there because it's just always so obvious, especially when we spend some time together. When I look at some of the other pieces, as I said, the SWOT, the strengths, the weaknesses, opportunities, and threats, we have some challenges around, what are we going to do around growth? And I know the board has talked about that and what do we do around growth? And growth is both a strength and a responsibility. And so as we continue to look at expanding, it also means that we put into focus policies, that we look into focus as to how do we expand? Where do we expand? How does it fit the mission? Where does it fit around the overall picture? And so that will be something that we'll look at as we go into 2026. And that really starting to create that infrastructure that ensures that this organization goes on long before any of us are still here. And so that will be some of the work that the board looks at over the next year. We also have our current environment of where we continue to develop a legislative voice. I think that ANA over the last couple of years has probably taken a little bit stronger position in that, and I think that our members are calling. I saw some of that in some of the feedback that we got from membership. Some of our members are really asking, okay, how do we get involved in this legislative environment? How do we have a voice? And I think we even heard that tonight. And so I think there's some opportunities for us to continue to grow that partnership and collaborate and really look at how do we have this evidence-based advocacy that makes a difference. And so I think that's an exciting thing. And then really continuing to expand our engagement with students, new nurses, and looking at just our overall involvement, and looking at it through our digital platforms and through all those areas of where we can be the face of Minnesota registered nurses. And then again, with growth and with change and with getting infrastructure in place comes along financial stewardship. And so that will be an area that we have to look at and continue. Our current financials look good. We have an infrastructure right now that really supports some growth, but probably if we were to really strongly grow or go off into other areas, it may be a little bit more challenging. So certainly financial stewardship is going to be an area that we'll see as membership grows, our financial will grow, and hopefully we can respond financially to the areas that we want to. And currently we've been able to do that. And then I just have a call to action. And the call to action is really that all of us, our future here in this organization depends on all of you. And so your engagement, your leadership, your ideas, the things that you can bring, showing up at our monthly meetings for education and companionship and space and being able to bring things, bringing ideas, bringing in new issues, all those things help us be a better organization. And so my call to action is that you continue to be involved, show up, be present, give us your information that you can share so that we can be better. And so that really is kind of what I've put together as our messaging for 2025 and going into 2026. Is there any questions for me? Would any of the board members add anything? Okay, well, if not, I am going to turn over the treasurer's report. I'm sorry. I think you've got the treasurer's report. Was there any questions? Nikki, did you want to go through anything in particular, or should we everybody's got it?
Yeah, Nikki isn't here tonight,
Oh,
so
she isn't. Okay. Yeah, so I mean, it was very straightforward. She also talked about the dues, so paying attention to just kind of some of the information on the dues, and then what we continue to look at with the financial activities. So, is there any questions on her report? All right. Any feedback at all? I think the one thing that I probably didn't have in my president's report, which I probably should have, is how many members have really attended education over the last year, because that's become a very foundation of what we are doing. And there's a lot of participation. I mean, 20 to 30 people every month, nurses come together at least and join in education. If no other questions or anything, I will close this portion of the meeting and we will begin our program. Thank you all.
Right. Do you want to stop sharing yours? There you go.
Oh, did I set here? I'll stop sharing. There you go.
Okay. Now I have to see if I can find, oops. All right. So we'll whip through this. So this is why MNORN is important to the American Nurses Association. The American Nurses Association is made up primarily of members, which are the state nurses associations. So every state nurses association has their own articles of incorporation. They have their own everything, and they are members of ANA. And together with ANA, we can do amazing things. And I just wanted to share this with you. I'm going to get rid of looking at everyone because I have some examples of when the states and MNRN and other states worked really well with ANA in ways that built on the strengths of both. So it's kind of a historical look. And you can see the objectives. And I'll send these slides out after. So ANA's current mission and vision is, the vision is a healthy world through the power of nursing. And the mission is to lead the profession to shape the future of nursing and healthcare. And they have they're working right now on a draft. They probably have, maybe Nicole knows if they've actually adopted it. But when we were together last week, we were is shown the draft vision for 2026, I think 26 through 28. The vision, a healthy world through the power of nurses. And then the mission, serving all nurses and advancing healthcare through engagement, advocacy, leadership, and excellence. I think both the current vision and mission and the new ones really reflect what we're trying to do in Minnesota also. ANA's current strategic goals are to elevate the profession of nursing globally, to ensure the professional success of nurses, and to evolve the practice of nursing to improve healthcare and health equity. And like any organization, you can only do that if you have operational excellence. Under the first goal, these are the elements under that: to lead the nursing profession, to lead, evolve, and promote standards of excellence, and to lead and promote the value of nursing. In the discussion tonight about what's going on for nurses and facilities around the state, the value of nursing is so important for everyone to understand. The second goal, to evolve the practice of nursing to improve healthcare and health equity, to advance diversity, equity, inclusion, accessibility, belonging, and anti-racism, to improve nursing practice and work environments, to engage and support social justice in nursing and by nurses to address inequities in health and care delivery, and to enhance nurses' abilities to innovate and lead in dynamic, disruptive, and complex practice environments. Holy moly, we have that. Goal 3, to magnify nurses' voices and to advocate to overcome barriers to personal and professional success, to design, advance, and implement innovative solutions. Nurses are the ultimate in innovators, so that's one that we just need to continue to highlight. Thank you, Ori Baudet. and to co-create holistic approaches for nurses' well-being with nurses and strategic partners. And then the fourth goal is to enable operational excellence, and that's, how they're going to take care of all of us as they are an organization that succeeds and thrives. The draft strategic goals for 2026 are a little different, but they're very similar. Amplifying the voice and visibility of nurses to drive policy practice and shape the future of healthcare, to champion innovation, professional development, and the well-being of nurses, to strengthen inclusive engagement and strategic partnerships to impact the communities nurses serve, and to ensure operational excellence again. You have to have an excellent organization to be able to do the work. All of these goals will be enhanced in partnership with MNORN. So here's my example. When I was on the ANA board in the early 2000s, and there is this nurse, Mary Behrens, from Wyoming, who's been like a force of nature in Wyoming since the beginning of time, I think. She was the mayor of Casper. She was a nurse practitioner early on. She's promoted she was in the State House. She's promoted nursing profession, both political and healthcare arenas, and testifying. And if there's something to be done, Mary does it. But why I'm bringing her up is that every single meeting I went to, she would talk about, when we were talking about the issues for nursing, either on the ANA board or the American Nurses Credentialing Board, she'd talk about what it means to be a nurse in a frontier environment, because it's not, Wyoming isn't just rural, it's frontier. She would talk about, how are you going to develop things that make sense to nurses who have to drive 20 miles to their mailbox, and if she just taught me by like always driving home, like, you're talking about this, here's how it's going to play in my state. And I think that all of us, when we go to national meetings, need to say, this is how it works in our state. And I know the meeting Cammie and I just were at, the nurses from some of the southern states, like when you were talking about some of the political agendas, they're like, you don't know how hard it is for us. So, by us really having a sense of what's going on everywhere and making sure our states stay focused on the the partnership with ANA, it just makes us better. So now I want to talk about the mass resignation of American nurses in 1966, because this is a wonderful example of what nurses did at the state level and at the national level to make a difference for at a time of nursing shortage. Can you guess how much a newly graduated nurse could make in 1966? Their beginning salary was $4,300 a year. That was the national average. Most women were either secretaries, teachers, or nurses, and the nurses' salaries were the least. So there was this sense that there was, if we wanted more nurses, we were going to have to raise their salaries. There was a severe shortage of nurses in 1966. Some of the we always think that when we develop new technologies, it's going to make nurses work easier. And so far, it really hasn't. It makes it better, but it makes it more complex too. So there were new medications and that needed to be monitored. There were coronary care units all of a sudden. So it was, instead of just having the sicker patients farther away from the nurse's station because they were going to die, they brought them closer to the nurse's station so that they could survive. Medicare and Medicaid had just started. Other technologies were starting. And then the Vietnam War, which was siphoning off a lot of nurses who went to Vietnam. So there was a real shortage of nurses in the U.S. In New York City public hospitals in 1965, there was I found things in the old AJNs about this, and so a nurse said, sometimes I'm the only professional nurse for 300 patients. Um, in the New York City hospitals were in a contract with the city, and they were in the fall of 65, 57% of the RN positions were unfilled. There were 8,000 positions budgeted and only 3,200 were filled. And then they covered with nursing assistants. And I have no idea what this particular machine is that this nurse is using, but it's quite intriguing to me. So if anyone knows what it is. Bellevue Hospital in New York City, on August 6, 1965, only 3 RNs for 12 medical wards meant only 1 RN for every 90 patients. On the night shift, there was only 1 RN and two LPNs for 12 wards. And the wards were on different floors, so it would be one nurse for like 3 floors. And there were 279 patients that day, and 74 were on the critical list. And the nurses said, "No, it's just a typical shift." The New York City contract expired. And so the initial proposal meeting, the city offered a pay increase of $5 a week. That was their final offer. They weren't going to negotiate. Negotiations stalled for 5 months. There was no option of strikes. Nurses didn't have the right to strike until 1974. In 1935, there was the Wagner Act that protected the rights of most private sector workers to unionize and strike, but it didn't really address healthcare workers. And then the Taft-Hartley Act in 1947 significantly restricted union power, and it did not let nurses in nonprofit hospitals go on strike. And so and almost all the hospitals were nonprofit at that time. It wasn't until 1974 that Congress extended the protections to employees of nonprofit hospitals through healthcare amendments. So then nurses could not only bargain, but they could strike. So striking wasn't an option in 1965 or 66. Um, Mary Finnan, who was a leader at the New York State Nurses Association at that time, said, "We presented our proposals. The city presented its refusals." That was their first mediation session. In April of 66 at the Bronx Municipal Hospital, there was a meeting and for the nurses where they were going to give them an update on how negotiations had gone. And they said, there's been no progress. We're just stuck. And one of the nurses who was sitting there, and I never could find out who it was, said, "We can all resign one by one, or we can resign all at the same time, and they will have to pay attention." So that one anonymous voice ended up bringing action. 41 nurses at the Bronx Municipal Hospital submitted their resignations. By the end of the week, more than 2/3 of the nurses in that hospital had resigned. And then within 2 weeks, nearly half of all the nurses in New York City had resigned. That was then a crisis for the city. So the city agreed to some fact-finding, which was some kind of mediation thing. The process began on May 10th, but it didn't last very long because the nurses' resignations were going to become effective. And so both sides came to agreement on May 18th, and the nurses got the contract that they were hoping for. So that came right before the 1966 ANA convention, which was held in San Francisco. The convention had 1,014 delegates, so it was big. It had 8,000 attendees. At that time, all the specialty nursing organizations were part of ANA. So it was the place to be. ANA's total membership at that time was 160,000, and there were only 909,000 registered nurses licensed in the United States. So it was a significant force. So the New York nurses came to the convention feeling very victorious. They had done this mass resignation. They had gone on. They hadn't been able to go on strike, but they had been able to achieve their salary goal, and so they came up with wanting to have a national salary goal for nurses that ANA would support. Um, at the same time, ANA had been talking about, leadership had been talking since the mid 50s about we should do something about this low salary, and they hadn't ever been able to figure out what to do about it. But they decided at the same time as the New York City nurses were having success, they decided that it would be the time to actually have a salary goal too. So all the forces came together at this convention, and they decided on a goal of $6,500 a year for beginning nurses in 1966. There were 6 states, including New York, that wanted it to be 7,200, but that was rejected as unrealistic. So, interestingly, um, Minnesota had a lot of presence in this decision. The chair of ANA's Economic and General Welfare Committee was from Minnesota, Valatree Storden, and she gave a special commendation to the New York City nurses and introduced a resolution for the first salary goal. And we also, Audrey Lotson was a member of the ANA board then. So, and she was a strong leader in Minnesota. So you can see that this national salary goal hit the New York Times. And here you'll get the slide so you can read the resolution about why the national salary goal was created, and then what it was. And that therefore be it resolves that the American Nurses Association adopt a competitive national salary goal. In 1966, a registered nurse should enter the profession at a yearly salary of no less than $6,500, and may it be further resolved that state nurses associations inform their membership, the employers of nurses, and the public of this national salary goal, and using all methods consistent with the ANA Economic Security Program, work towards its implementation. So ANA sent the nurses home. They sent them, it was before we had email, faxes, texts, TikTok, Facebook, or any of that. They sent them with some documents that they could duplicate at home, and promised that they would help, and they would help the states in any way they could, which was mainly in communication. The American Nurses Association owned the American Journal of Nursing then, and every issue of AJN had information about how this campaign was going for state nurses associations to raise their salaries. So here you can see in California, they picketed at the Capitol, people in white with salaries in the red, and a sign that said the time has come when nurses can no longer subsidize health care. In Tucson, Arizona, they got a 7% increase after threats of resignation. Washington State set their goal at $7,200 for associate degree and diploma grads, and 8,000 for baccalaureate, and had increases all over the state. And Idaho had one of the longest work stoppages when RN resignations actually became effective. All of the nurses were rehired after 16 days. Colorado, 8 nurses were terminated before the resignations became effective. And then they ended up getting 16% increase after threats and resignation from a different group of nurses. North Dakota, the North Dakota Hospital Association agreed with the salary goal. I think they were the only ones I found who actually agreed without encouragement. And they recommended a 3-step increase to achieve it by 1968. Iowa private duty nurses raised their fee for an 8-hour day. In Kentucky, there were 38 public health nurses from 9 counties that organized as a group to demand higher salaries. So everyone, different states did it differently, whatever worked for them. I knew first about the mass resignation because I knew Minnesota had one. And I would hear stories and I'd hear bits of stories. And I never got the whole story all at once. But every time I'd hear something about it, it just kind of made my hair stand on end because, like, wow, those nurses were so courageous. So, what they did, 1,200 nurses attended an all-nurse meeting, and on an individual basis, the nurses decided to resign. There were between 1,450 and 1,650 written resignations with an effective date of December 26th. So at that time, the head nurses or um, the head nurses were in the contract also. MNA had a contract. This was the Minnesota Nurses Association. And they had a contract, and the head nurses were part of it. So when the nurses submitted their written resignations on some units, the head nurses were just put those resignations in a file cabinet rather than sending them on to HR, just hoping for something good to happen. The stories are remarkable of things that happened. Like one night, the negotiating committee kept on waiting for the hospital negotiating committee to come back from being in their own meeting, and the hospital negotiating committee went home without letting the nurses know, and so the nurses were there all night, and the hospital they were all in bed asleep. So anyway, they did get a final offer and did bring their salaries to at least 6,500. There was national support for the nurses during this time. LBJ was the president, and when he presented the budget to the 90th Congress, he commented on the low salary scale and poor working conditions of nurses. And the Surgeon General said it's not easy to work an overnight miracle and raise nursing salaries to levels where they belong. Yet I am convinced that it must be done and done quickly. And one of my heroes was the AJN editor, Barbara Scoot, who made in the AJNs made that the whole campaign of the mass resignation live and breathe. And she said today, the nation is called on to dedicate itself to support for nurses and other health professions. So that's one of my examples. The other one is the Safe Needles, Save Lives campaign that happened around 1995 to 2000. There were this was when we were starting to really be concerned with reason about needle stick injuries because of the HIV epidemic. And these are some examples of some nurse advocates, all of who had needle stick injuries. Linda Arnold, Lisa Black, and Karen Daly. Lisa Black still lives in Nevada. She had a needle stick to her hand while taking care of a patient with end-stage HIV in 1997. So patient, she tried to flush a clogged IV line in a patient with end-stage HIV. He jerked and she got a needle stick to her hand. She developed HIV Hep C 9 months after exposure. She ended up being terminated. At that time, nobody knew what to do with nurses who were HIV positive, if it was safe for them to be taking care of patients. She said, "Nothing will give me my life back as it was before HIV." Um, and Hep C were part of it, but I would like my experience to be used to prevent similar tragedies from happening to other healthcare workers. She ended up with her PhD and teaches nursing. Every publication I can find that she's written has been about needle safety. Linda Arnold, she had a needle stick injury 5 months after she graduated from nursing school. She tested positive for HIV within 6 months of exposure. Again, she was hit in the hand with a dirty needle. She had inserted an IV into a very sick new admission. He jerked his arm, and the needle was in the palm of her hand. And she found out later that the patient was known to have HIV. And he actually died 2 weeks after she cared for him. 4 years later, she started a campaign to ask every hospital in the US for a written agreement that they would provide safe needle devices for their employees. At that time, I was going to a fair number of national meetings, and every time I went to a meeting, no matter where it was, Linda Arnold was there with a stack of clipboards and documents that she wanted us to bring back to have our employers sign a pledge to provide safe needle devices. Um, I think she's still doing okay. She's has had developed some HIV dementia, but and writes a blog about her experiences of living with HIV. She was just, I couldn't, every time I turned around, she was at another meeting. And then Karen Daly is the third one. She was the president of the Massachusetts Nurses Association when I was the president of the Minnesota Nurses Association. And so we were colleagues from that. She had been an RN for over 20 years when she had a needle stick injury. Um, she worked in the emergency room and was putting a used needle into a sharps container, and it was one that was designed like kind of like a mailbox with a flap, and it's a horrible design. And there was a needle sticking up, and it was a bit busy shift, and she went to put um, her used needle in it, and not realizing that there was a needle sticking up, and it stuck her, and she too developed HIV Hep C. She was a nurse who was beloved in her hospital, and even while she was working there, there was an annual award named after her. But like the other two, she was terminated because they didn't know how to work with nurses who had HIV. She had a great platform, though. She was the president of Massachusetts Nurses, and she knew her Senator Ted Kennedy quite well. And she was able to work both at the state level and at the national level to try to get federal legislation that would strengthen the new OSHA compliance directive to the bloodborne pathogen standard. So, yeah, needle safety required both the legislative and regulatory actions. So you can see here that there were those two things. And we worked simultaneously let me go back just a second. We worked both simultaneously to get state laws and national laws and regulations passed at the same time. And before the campaign, there were needle safety devices, but they were either some of them were poorly designed. Nurses weren't involved in um, uh, selecting them, or else hospitals would say, well, they're just too expensive. So let's fast forward to today's ANA. we have ways of getting involved with nurses' voice, um, both as individuals and as states. We have ANA professional issues panels. They are panels whose purpose are to try to do informed decision making, member engagement, and active dialogue. Um, I know we're kind of running short of time, so but Mary, I know that Mary Tanner's on the call, and she was the chair of the 2015 ANA um, revision to the Code of Ethics document, which went through a professional issues panel. The thing about the panels that was really fabulous, and I say was because it's been a while since ANA's called one, and I hope they'll do it again soon. But there was a steering committee and an advisory committee, and if people wanted to serve, everyone could serve. Everyone who wanted to be on the committee could be on it. So it wasn't like just for the blue ribbon expert panel kind of thing. And like I'll show you the here are the panels they had. The one on nurse fatigue. I remember that on the steering committee, there were the scientists, nurse scientists who were studying nurse fatigue. And there was also a staff nurse who almost fell asleep on her way home from a night shift. So professional issues panels are a great way for the state voice to become part of creating a national policy. The membership assembly dialogue forums are another great way for us to have our voice. You could see in our elections, we asked you, what would you like to have ANA talk about in a dialogue forum? And that's how Minnesota, our MNORN, first begins to formulate what we might submit as a dialogue forum topic. And so that's the process for that. And so in 2025, we submitted a proposal for a dialogue forum topic, the economic value of nurse faculty, insufficient faculty pay and its impact on the nursing shortage. And you can see here what the recommended actions were. It was not selected to be a topic, even though everyone I talked to said, wow, that's a great topic. And it continues to be a great topic. And we have been encouraged, MNOR has been encouraged by other states to submit again. And so the board has decided that they do want to submit this again for 2026. And what we're doing now is trying to asking other states to sign on as co-sponsors to try to help increase the likelihood that it be selected. At membership assembly, there's time for 3 dialogue forums, so there's a lot of competition, but I think this one's super important. So far, Arkansas, Montana, Kentucky, New Mexico, Wisconsin, have signed on. I think Connecticut and Illinois will probably, and I'm working with Washington and Oregon, and whoever I ask, whenever I have time, when Cami and I were in DC, we talked to as many people as we could about this. And whenever we ask, they're like, oh yeah, of course. So anyway, that's our goal for this year. But the topics that came up from this year's ballot, we can also use to help inform our work with ANA. We can also use it to help create what we're going to offer for education sessions during our own MNRN meetings. So in Ori, you get the last word.
Can I just say something, Kathy?
Yeah.
First off, I'll say Kathy says we really tightly, but it was Kathy really getting the support around around our meetings and getting the state support. So I really think appreciate that and the work that you do in the behind the scenes of that. The other thing I would add is that whenever we talk about this, I think we can't do nursing without nursing instructors
Right,
and professors. I mean, nursing will not exist if we don't have people to teach nursing.
right,
And,
right,
and we're getting to that more desperate time. And then when you look at that, advanced degrees are required to be able to have professional nurses be trained and educated now. And when we're looking at the loan and all of that, I mean, it all goes hand in hand at a really crucial
right,
time.
right. Exactly. And so when I've talked to a couple of esteemed uh, emeritus faculty members about this topic over a year ago, I thought they would say, "Oh, that's so nice of you, Kathy, but don't worry about it. We'll take care of it." They said, "Do it." And then when I talked to Connie Delaney at the University of Minnesota, she said, "How can we help you?" And when I talked to an associate degree faculty member, um, she started crying because she's like, we know that the minute our students graduate, they're going to be making more money than we are. So, I mean, this is an issue. Like in 1966, we worked on staff nurse salary, and we need to be working on faculty salary because otherwise we won't have it's our pipeline, and it's justice and equity and all of that too. So anyway, your ideas and creativity will design and build the future of healthcare. And as challenging it is as it is today and tomorrow and the next day, remember that we are really important, and our creativity will help us be able to survive that. So I have some resources, references, and I'll send you the slides. So that's my story for tonight.
Does Ori have anything to add?
Hey, everybody. No, I mean, these are just incredible sessions. Thank you so much for letting me be a part of the conversation. And I just think about all of the conversations that actually opened tonight's session and kind of convening and, with honesty and vulnerability to Nicole's point and the recognition that to not talk about the things that are difficult would feel disingenuous to the moment, right? Recognizing the complexity that's in front of us and that our patients and communities and populations are dealing with, as well as, our peers and our coworkers and our society as a whole. So I think the history is fascinating and important around how nurses have shifted, how people think about the profession, and how we as nurses think about what's possible for the profession and what that means for the communities that we care for. So I just think tonight was a fabulous event. Thank you so much for all of the thought that was put into this. And thank you for the leadership of everybody who is off going from the board and excited for those new leaders who are transitioning in. And, Cami and Kathy, just extraordinary work. And thank you. Thank you both for everything that you do.
Oh, thanks.
All right. Does anybody know how cold it is outside now? Be grateful that you're not going out after a meeting.
Yeah.
It feels in mid St. Paul right now, it feels like -8. So
Oh,
Yeah, it's 12 degrees in Woodbury. I don't know what it is with the
uh,
wind chill though, because the wind's out. Yeah.
yeah. The only good news is that when I make my dog go out, he comes back in easily.
yeah. And looks
So
at you with eyes like,
what,
oh,
what
what
did
did
you
you
just
just
make me
do?
do?
Yeah.
So, thank you so much for being here, and I hope all of you get a bit of time for reflection and enjoying however you celebrate the holidays. And yeah, we'll see you
Thank
next
you.
year.
Yeah.
Thank you.
Thank you.
Mhm.
Kathy,
Thank
can I just say something? Sorry, I have echo.
Yeah.
I literally am hiding in my bathroom from my kids. So I am going to be coming off the board, and I am so excited for the new leaders who are going to come onto the board. But I just wanted to say, like, I get so emotional. I came to Minnesota, such a broken person, losing my brother and Kathy, and this organization took me in and literally pieced me back together just being around such beautiful souls. And nursing is so much more than nursing. And I'm just so, it is being on this board has profoundly changed my life. From this board, I'm now on the board for ANA, and I could not have done that without the people on this board. So, from the bottom of my heart,
Oh,
like, thank you for everything you guys have done for me.
Mm.
It's been an honor. So, just thank you. I leave such a better person, a better mother, a better friend, a better nurse from being around all of you. So I'm so excited for the ones coming on who get a little piece and taste of what I have been able to have. So I'm here if you guys need help. And again, just thank you, thank you, thank you for everything. I appreciate you all.
We
So
love
we
you
get
so
to
much.
you.
And I
Yeah,
just wanted to say too that we're not losing Nicole because she's still on the
that's
ANA
right.
board representing us. So we've got you.
I'm here. All right. Well, happy holidays, everyone. Good night.
yeah, I'll be all
Nice.
Good day.
Thank you all. Good night.
right.